Well, good morning, everyone. How is ya? Waiting for a few folks to come on here and say hello. We'll do a short roll call this morning because we got a lot of questions. For a question, Debbie. Well, good morning. How are you? Okay. Folks are coming on. Patricia, nice to have you on. Rosalinda, Niagara Falls, good morning. Jose, good morning. Carrie, Nebraska. Connie and Francis Marie. Nativity, good morning. Mabel and Gloria. Mary, good morning. And Frida. Wendy, good morning. Yolande, good morning. Dubravka from Belgrade, Serbia. Good morning. Jennifer, Jeanette, Georgie, Andrea, good morning to you. Nouveau Brunswick, Zian, Blainville, Ontario, Maria, William, Elaine, Darcy, and Brian. Wanda. VA means Virginia, right? Kristen, Chantal, Ottawa, Joan, Summerside, Janice, Jeanette, Jerry, Nouveau Brunswick, Anne, good morning, Moncton, and Marcy. Nice to have you. Deb from Detroit. We appreciate you guys. You know that, right? Okay, Barbie. And Fran from Orangeville. Thank you for coming on, guys. We love you dearly. Jeffrey, Mississauga, Irene. I'd be singing all morning if I could. All these names. Helen and Nick from our staff. Okay. Mitch is asking, is there any benefits to nutmeg, which is a spice, right? Oh, I'm sure there is. I'm sure there is, Mitch. But I got to give you the answer that I always give when it comes to any other spice. Like, I like cinnamon. That's a great spice. Helps with your blood sugar. Very good. But there's nothing, Mitch, nothing that compares to oil of oregano. I am a big oil of oregano guy. I have been for a multitude of years. Clinically, I got results with it. So any spice that I compare to it, and spice, different spices do different things. But oil of oregano is all around antiviral, antibacterial. It's nature's number one natural antibiotic. But it's also antiviral. You get a double whammo. It's antifungal. It's an antioxidant. It is an antihistamine, a natural antihistamine, meaning it's very good for allergies. And here's me. I love the sprays. I find them very convenient. I call them spray and pray, because you're going to have to pray after spraying them. Okay? Because there's a throat spray for kids. It's still very strong. It's like Buckley's. Tastes awful, but is very good for you. And we put oil of oregano right in our digestive enzyme to kill SIBO and SIFO. By the way, we have a question about that this morning, so we'll talk about that when we get to that question. But anything that I do, Mitch, I'm going to compare it to oil of oregano, and it's not fair for the other spices. Okay, it's just because clinically I used it. I talk more about oil of oregano. They used to laugh at me when I had my own radio show, The Doctor Is In. And, I know what Dr. Martin's going to say. Oil of oregano. They were usually right. I loved it. I still do. And like I said, I'm a big guy on the sprays. You can use drops. You can use it even in a powder. We powderize it to put it into our digestive enzyme. The only digestive enzyme in the world with oil of oregano. So good for you. And you know what? It doesn't kill your good bacteria. It's not like an antibiotic that wipes out your good guys with the bad guys. This, God's natural antibiotic, knows the bad guys and keeps the good guys. How do you like that? Anyway, Mitch, thanks for the question, okay? Because it's a very good one. And I don't mind talking about oil of oregano, my favorite spice. France. Do you have to, I'm going to say take B12 with a B complex? As I have been told, you need to take both to work together. That's first of all not true. Let me separate this for a second. France, when you take a B complex, you'll always have B12 in it. Because it's a B complex that has all the B vitamins in it. I'm not big on that. Look, it's not that I've never used B complex. I use it in our blood boost. Okay? You'll notice there's a B complex in there, all the B vitamins. And that's for people that are really run down, or anemic, or really lack of energy, people that are going through cancer treatments or whatever. Blood boost is a powerful, the best on the market by far, of a multivitamin, multi-mineral, herbs that I like. I put them together in a secret sauce called Blood Boost, okay? It's tremendous. Now, what you heard is not true. B12, and to prove my point, is that B12 has been for, more than 50 years, 70 years. I should Google it, find out when they started giving injections of B12. Doctors in the 1950s, in the 1940s, in the 1960s, and then they got away from it. I mean, if you were tired, you got a B12 shot. You didn't get a B complex. You got a B12 shot, B12. And the best B12, proven now, it's not that I don't like B12 shots. I do. Okay, I do. But the best B12 now, proven, is to take it, when you need it, take it on a daily basis in a sublingual form, and make sure it's a methylcobalamin in the sublingual form. Let it melt under your tongue, and you're going to get B12. Okay? You don't have to take it with a B complex. B12 is a separate vitamin in this sense. It's a very finicky, large, structured vitamin. You need a lot of things to get B12 to get it right. And you really only get B12 in food in the animal kingdom and when you eat red meat. You get a little bit in pork. Pork is considered red meat. But the best is vitamin S steak. The best. Liver, but you know me, I won't talk about liver. But you need that. Okay? So yeah, B12, and you don't have to take both together. As a matter of fact, I want you to eat your B vitamins. When you eat eggs, meat, and cheese, you get all the B vitamins you need. But a lot of people need B12 because they don't have the intrinsic factor, they have digestive issues. If you're on almost any medication, you're usually deficient in B12. That has been my experience. So those people need to take B12. Now, there's another question about B12. Let me get to it. I might as well do it right now. Okay, Nez. Okay, so thank you very much for that question, France. But Nez is asking, for a 2-year-old who chews meat then spits it out, is it safe to give them a B12 a couple of times a week? Well, it's safe, but I wouldn't... You don't give a 2-year-old B12 necessarily. Now, first of all, how are you going to give a B12 to a 2-year-old? In what form? If you're swallowing a vitamin, good luck with that. You're not getting B12. You can't swallow B12. You can eat it in steak. And if they're chewing on steak and then spitting it out, keep feeding it to them. Okay? And, but as far as giving a baby B12, like what form? That's what I mean. Like if you get a multivitamin and give them B12, you're going to get the wrong B12. You're not going to get methylcobalamin. So now, the body doesn't absorb that. So, yeah, Nez, like it's a good question, but I would rather you just let them chew on the steak. Okay? I'd rather that they get their B12 that way. Now, Deanne. Hello, Deanne. Does type 2 collagen help with increasing healthy tissue like muscles, skin, and brain? Yep. I love collagen. Your body is made up of collagen. Why do you think, Deanne, I love bone broth? Bone broth is collagen protein. Good for your hair, your nails, your skin, your gut, because of L-glutamine in it, naturally occurring amino acid, L-glutamine. It's so healing for your stomach. That's why I love bone broth. Make it on your own, and we make one. It's tremendous. One of our most popular products. Very good for your skin. Very good for anti-aging. Is bone broth or collagen. You can take a separate collagen if you want, but I'm not that big on that. I like bone broth better, or make your own bone broth. Now, somebody asked this. Let me get to this here, because it'll go along with this question. Hold on now. Oh yeah, Manik was wondering, the gelatin-like substance in the tray when you cook meatballs, is it collagen, and what is it from? Should we add it to sauces? Well, that gelatin-like substance is fat, and to some extent a little bit of bone broth when you cook your meatballs. But most of that gelatin is fat. Is it good for you? You better bet your boots it's good for you. Bet your boots. And sure, you can add that stuff. It's so good for you. All your fat soluble vitamins are there. Yeah, I like it, Manik, for sure. I like it. Okay? Now, okay, so we got Mitch, we got France, we got Deanne, and now Deed is asking a question. Why would a 12-year-old have sleep apnea? Well, that's a little bit unusual at their age, but I'm going to tell you, in this day and age, it's crazy, but it can happen, and the reason is, look, sleep apnea. I'm not kidding you. If you were to go into my textbooks, I've got to the left of me and in behind me a lot of my medical books. that I've kept over the years. Okay? If you look up sleep apnea, good luck. In my old books in the 1970s, what? Sleep apnea? Why do we have sleep apnea? I'm a why guy. Why do we see sleep clinics sprung up everywhere? Major issue. Now, how do they help sleep apnea? They give you a machine to send oxygen into your brain. True or false? Yeah, that's what they do. Why? Why do we have it today? Comparatively. I mean, I'm not saying there was never any sleep apnea before, but it sure wasn't documented in my medical books. Why is it an epidemic today? I'll tell you why. It's insulin resistance. Insulin is a fat-storing hormone. And when we insist on being carboholics, and when our kids are carboholics, and they are, our grandchildren, you know what they get? They get a fatty tongue. They don't just get fatty liver. They get a fatty tongue. Yeah. They get a fatty tongue. And you get a fatty tongue when you get insulin resistance. The best way to fix sleep apnea is to change your diet and go on the reset. Now, is a 12-year-old going to do that? Going to be difficult. But that's the problem. It's an insulin problem. And sleep apnea, by the way, is very dangerous. People who get sleep apnea have twofold, twice as likely to have a heart attack, twice as likely to be dementia. The solution is not a machine. That's a Band-Aid. Sleep with the machine. Yeah, go for it. I'm not telling you not to. But what I am telling you, you better take it a step backwards and find out what the real cause of that lack of oxygen up into the brain in sleep apnea. It's fatty tongue. And fatty tongue don't come out of nowhere. Fatty tongue comes from the fact that you have insulin resistance. And insulin resistance, take it one more step back, is my name is Tony and I'm a carboholic. Sugarholic, carboholic. Yep. And I doubled down on that. That's why the reset has helped so many thousands of people with their sleep apnea. Unreal. Okay. Very good question, indeed. Catherine, what do I think of? No, it's not what I think. What do you suggest for bunions? Well, bunions is a structural problem in the feet, right? I'm a big guy on fixing fallen arches because bunions are usually bad shoes and bad arches. You know, I saw thousands of bunions in my practice years. And two things, bad shoes and bad feet, bad arches, metatarsal arches falling. I'm a big guy on using a tennis ball or use a ball, use a bottle, roll your feet. Once you got bunions, it's hard to fix. Hard to get rid of bunions. Stop it before it starts because you got a metatarsal problem, and don't wear bad shoes. Not all, but most people who get bunions are women. They wear bad shoes. Bad feet, bad shoes, bunions. Okay. Brenda, if I don't have high blood pressure, why would I see my pulse in my neck a lot? On the right side, close to the collarbone. Well, it's just the way it is. Quit looking. Brenda, you know me. I like to tease, okay? It's not dangerous. You don't have high blood pressure, okay? If you don't have high blood pressure, you got nothing to worry about, honey. It's just the way it is, Brenda. And it's visible. Some people you can see when they get angry, you see their veins popping out. You know? Well, don't get angry. But you know what I'm saying, okay? Yeah, nothing to worry about, Brenda. Nothing you can do about it, nothing to worry about. And don't get all uptight about it, because that'll stress you out, and that'll elevate your blood pressure, okay? Sylvia, you mentioned recently that if someone has SIBO, or SIFO, which we like better, small intestine fungus overgrowth, they also have a malabsorption issues. Yes, they do. Almost invariably. You got trouble. Okay, I was told that I have SIBO a few years ago. This to mean that I'm not able to absorb the supplement. No, listen. Listen, Brenda, Linda. No, or Sylvia. Sorry, Brenda was the last one. Sylvia, listen, okay? When I tell people over the years, when I've told people over the years that they had a malabsorption syndrome, that doesn't mean you're not absorbing anything. You know, otherwise, why would you even eat? I got a malabsorption syndrome. I'm not absorbing everything. I'm not absorbing my food. Yes, you are. Not all of it. It's even more important if you have any form of malabsorption syndrome to fix it. And the only way you're going to fix it is to take supplements. I mean, if you don't take a broad spectrum probiotic, well, doc, I got a malabsorption syndrome. I know, but you got to fix it. And the only way to fix it, eat good. You're still going to get nutrition. You might not get as much until it's fixed. You got to kill the yeast. How do you do that? Well, you better be taking a broad spectrum probiotic. You better be taking our Candida formula. Our digestive enzymes with oil of oregano, because that kills fungus and it kills SIFO and SIBO. That's why we formulate it like that. Yeah, you're not going to absorb 100% of it. But don't, like now you got to fix it. That's the key. That's the key, Sylvia, is to fix it. Don't get into the weeds. So I'm not absorbing. I can't take anything. Well, you better eat. You better eat. You'll fix the problem. That's the key, is to fix it. Okay? So, fix it. What can I do to improve the absorption? You're doing it. Continue to do it. Your body will fix it with help. Claire, does using a skipping rope have the same effect as using a bouncer to help with our lymph nodes? Yeah, sure it does. Sure it does. Very good for you. I prefer the rebounder, okay? I like the rebounder. I'll tell you why I like it better than skipping a rope. Now, you're a kid, skip a rope. As you get older, I like the rebounder because now you're not getting the pounding on your knees and your feet. Now, I'm not saying that, if you're doing good, Claire, then keep skipping a rope. Act like a kid. It's actually good. But the rebounder is really, really beneficial because it gives you that lymphatic drainage. It really is effective as an exercise without the pounding. Very easy on your joints. I love the rebounder. And skipping rope, excellent, especially when you're younger. Thank you for the question, Claire. Okay? From my distant cousin, Claire. Yeah, Claire and I sort of hooked up because of this podcast. And, she sent me some pictures. I'm telling you, it's been a real joy to see some. I got pictures of my great-grandparents. Wow. I really appreciated that, Claire. Thank you. Okay. Nez, I answered Tenny or Tony. If it's Tenny, T-E-N-Y, you only missed by one letter of the alphabet, Tenny. You could have been called Tony. Okay. I have tendinitis. Okay. Now listen. If Tenny, it's spelled Tenny in front of me here. And if it's Tony, I apologize. If someone has tendinitis, now I did a whole podcast on this called itis, I-T-I-S. Whenever you see itis, tendinitis, right? At the end, one of the if it's recurring, let me just say this. If it is chronic and recurring, oftentimes it's a sign of insulin resistance. Here we go with insulin again. Tendinitis, bursitis, arthritis. Now look, you're an old football player. You can have arthritis. You might be bone on bone, old injuries. But a lot of people get a tendinitis and like carpal tunnel, where they get numbness in their tendons. And a lot of it is called glycation, meaning that they lose the elasticity and they have an itis forming with pain and it doesn't heal up. I'll tell you, do the reset. I love our inflammation formula for that. 8 anti-inflammatories put together. You find a better anti-inflammatory product than that, you let me know. But I've never seen one. Not as powerful as that one. Okay. Tendinitis. Watch out for insulin. I mean it. Jennifer, do you think mineral sunscreens or zinc products are safe to use? Yes, they are. They're safe to use, zinc. But here's me, okay? Here's me. If you're very susceptible to burn, you got glycation on the inside that manifests itself on your skin. That's why a lot of people, and I said this repeatedly, I've said it repeatedly, when they clean up their diet, it's amazing how much better they do in the sun. That's one. Number two, I'm very big on 20, 30 minutes of sun whenever it's out. On your arms and your legs. That's the sweet spot to get 10,000 IUs of vitamin D. And you'll never overdose on the vitamin D that comes from the sun. Never happened and never will. Your body knows exactly how much to take. So if you're out for 2 hours, well, you're not getting 20,000 IUs. You're getting 10. And your body tops off. Isn't it amazing how your body is fearfully and wonderfully made, knows exactly how much vitamin D you need from the sun? Now, don't burn in the sun. I'm not big on that. Absolutely not. But the sun is not the boogeyman. And when you put zinc on, or even natural minerals, you're not going to get the dehydroxy made from the vitamin D. Now, I'm not saying you can't use some coconut oil or whatever. Sure you can. And don't burn. Cover up is even better. Cover up is even better. Okay? So, yeah, you can make a natural sunscreen. I got no issue with that. But let yourself get, without the sunscreen of any kind, Let yourself get the 10,000 IUs of vitamin D, 20 minutes, 30 minutes, without anything on your skin. Okay? We have a natural Rivera. I put that on my face. And it allows the UVB in and it blocks UVA. But I'm big on just au naturel to get the vitamin D first, okay? But you can certainly do that, Jennifer, okay? Denise, can a hiatal hernia symptoms escalate by insulin resistance? Denise, absolutely can do that. Because insulin is when you're insulin resistant, you create an inflammation, even in the digestive tract. That does not help a hiatus hernia. Is it the cause of a hiatus hernia? Maybe. It has something to do with it. We see so much more hiatus hernias than we used to today. Whenever there's more of something, I'm always asking the question, why? Hiatus hernia has been around as long as mankind has been around, but there's more of it today. There's a reason. I go back to that diet of ours. Okay. Good question. Okay. Thanks, Denise. Lise, if stress response neurotransmitters live in the lining of the gut, like GABA, do digestive issues cause anxiety because your reserve is low, or does anxiety cause digestive issues? Example, if you have gastritis, does that limit your stress response because of the inflamed lining, or does stress cause gastritis? You know what I love, Lise? You're thinking. You're thinking. And I look, we know for sure that stress can be a big factor in gastritis. We know for sure that stress can be a big factor in depression, leading to depression. Now, what comes first, the chicken or the egg? Well, I'm big on the chicken coming first, and that is the stress response. Too much cortisol creates an inflammatory response. We know from, the butterflies that somebody gets. Think of that. What is butterfly? I got the butterflies. I'm nervous. My stomach is bothering me. I'm nauseated. I got an upset stomach because what is that? Well, that is your vagus nerve, which is your connection between your parasympathetic, your brain, and your nervous system to your gut. So yes, it's usually the stress that messes your digestive tract up first. Now you're messing up your feel-good hormones in your gut. Now look this can start even before stress, because there's a real connection between leaky gut. Think of autism. And I believe it's 100% leaky gut due to antibiotics or other factors. And that it messes up the baby's brain, the connection between the gut and the brain. I've done many a podcast on that, and I would ask you, Lise, to review those. But you're thinking right along with me. The chicken or the egg? Very good question. Rita, what is the proper level of protein in the body, and what can you do to lower if it's too high? Now, Rita, this is not spelled out in your question, so I'm going to answer your question two ways. Because I think what you're asking, what happens if our protein is too high in the urine? That is a sign of kidney stress. But it's not, Rita, it's not because of protein. Okay? When your kidneys get stressed, and one of the signs of that is protein in the urine. It's not because you're eating too much protein. You're not eating enough protein, and you're eating too much sugar, or crappy carbs that turn to sugar in 5 seconds. That's the hardest thing on your kidney is sugar. So I think, Rita, that's the question you're asking. Okay? Guys, listen to me. There's no limit to protein. There's no limit to it. You're never going to get in trouble eating too much protein, ever. Did you hear what I said? Ever. Well, Doc, how many eggs can I eat? 100? Now, you're not going to eat 100 eggs, but you could. Don't worry about eating too much protein. I talk to athletes every day. And, sometimes they get mixed messages from dietitians and nutritionists and, like you need carbohydrates and no, you don't. If you want to eat them, okay. But the best food is protein. Eggs, meat, and cheese. Don't throw dairy out. Don't throw the baby out with the bath water. I want you to throw milk out, but not cheese. And you're going to get the way you're supposed to eat. God put protein and fat in combination, perfection in eggs, perfect. Meat, perfect. And cheese, perfect. All your vitamins, all your minerals, everything that you need. Okay? So I think that's what you were, and if Rita, if your protein is too high in your blood work, remember, it's not protein. It's carbs. Simple as that. That's how you lower it. Thanks for the question. Connie wants to ask me about coffee. I love it. I'm hooked on coffee. Okay. And for all the right reasons. Does coffee have all the benefits you spoke of on Wednesday, and we did a session on coffee, if you just add pure cream? Yep. Pure cream. Yep. See, don't ditch dairy, switch it. Now, I like black coffee. It's probably a little bit better, strictly black. But cream is good. Milk, no. Cream, yes. Cream. Fat. Dairy fat. Very good for you. Okay? And when I say eggs, meat, and cheese, I mean cream too. Okay? Okay, thanks for the question, Connie. Mireille. Where do nose polyps come from? The nose. I'm teasing you. Well, look, Mireille, like polyps can come anywhere. They're growths. Okay? They're growths. And here's me. Some people just have a tendency to make polyps. Here's me with polyps in the nose. I believe that nose polyps are very specific to a fungal infection. As a matter of fact, I think almost every polyp that you could think of, polycystic ovarian disorder, PCOS, yeast, fungus, candida, They make things grow. They are growths. Don't feed the bears. Don't give them sugar. Get your insulin down and get your estrogen down. The two growth hormones your body makes. Too much estrogen, you're too much of a woman, and too much insulin, too much of a carboholic. Get those down and watch your polyps. And when you don't eat sugar, you're not feeding yeast. And I believe yeast is one of the biggest problems. Gloria, how can we possibly get the required 3,500 to 4,700 milligrams? Do you think that's a lot? That's not a lot. Potassium a day without eating fruits. Well, look, eat eggs, meat, and cheese. You're going to get all the potassium you need. Yes. Now, you might have to add a Himalayan salt. And someone that gets cramps, sometimes I'm giving them potassium. We talked about that yesterday in the electrolytes. How much your body needs. And some of us sweat out those electrolytes. And one of the biggest factors in electrolytes is when we insist on being sugarholics and carboholics, because the body, first of all, retains, and then you get edema, then your body, you're peeing out your minerals. But Gloria, you can eat them. If you're getting muscle cramps, then you need to supplement with potassium. Dorothy, I have a question for Dr. Martin. My total cholesterol is, I don't care. Dorothy, I don't care. I really don't. My HDL is 50, okay, and then what I look for, your triglycerides is 124. Now, your doctor wants to put you on medication. What do you think of Praluent injection? Look, this is not for you, male. Okay, so this is for your husband or whoever, right? Look, I'm not going to tell you to take medication or not take medication. I'm not doing that. Okay? It's not my job. I'm not your family doctor. My job is to give you information. Now, here's the information, Dorothy, that you can tell to your husband, whoever that male is, who's 55. Here's what's important when you look at your lipid profile. Look at your triglycerides and look at your HDL. That's all I need. That's all I need. If you want to give me your LDL, okay, but I'm not really interested. You want to give me total cholesterol? Who cares? I don't care. Okay? It's not that I don't care about you, but I don't care about cholesterol. I want HDL to be high. And here's the problem with this age. 55 male. He's got HDL at 50, and he's got triglycerides at 124. He's in trouble. Why? Because his triglycerides and HDL are upside down. His triglycerides are higher than his HDL. That's not good. That's not good. And the only way to fix it is to get on the reset and change those numbers. Because he's upside down. And I'm not commenting on the meds because I don't know that person. And this is the way I look at it. And I'm right. It's not arrogance. It really isn't. It's the truth about your lipid profile. Okay? Thanks for the question, Dorothy. Okay, I think I got them all because I did my next already. Hey, you guys are great. Have I told you? I was almost going to sing, but I'm not. I love you guys. You guys are smart. So incredibly smart. Okay, We got a great week coming up next week, Lord willing. And we're going to have we're going to look at some studies that are really interesting. We got some good stuff coming. Now, not too early to ask your questions for next week. Question and answer, okay? Okay, guys. We love you guys, and we talk to you soon.